Absolutely. I mean, it's interesting you say that. I worked kind of in Abu Dhabi. So when I was importing drugs from all over the world for emergency medicine, for ambulances, I really struggled to get hold of really simple items like an EpiPen or even inhalers, aspirin. And sometimes the EpiPens would take 6 months to arrive because they would come from the UK and they would get stuck in transit. Maybe a permit wouldn't be released, so they would be stuck at the airport for a really long time. And that was my first experience of really understanding what it was like to work in an environment with supply issue.
Mm.
I think we've been spoiled in the UK up until now, probably because we've had access and availability to most medications. Um, if not everything, the access has been great to the point where you've got a few options for that condition, so you've definitely got a variety of medications you can try for that disease group. But
Mhm.
even at this point, we've fallen into the position where we've got an antimicrobial shortage, and everyone is posting all over social media at the moment the empty shelves within pharmacies, and it's absolutely like it's shocking, it's worrying. It's I work in pediatrics, that's really scary to not have access to antibiotic liquids. So I feel like we've taken a step back, but for different reasons. But it is really useful to some regards. Obviously, it's a difficult situation to be in, but from a learning experience, to be exposed to that environment and then have to think outside the box that, okay, we don't have access to these medications. Well, what can we do instead? And maybe people then get into a habit of actually thinking about disease prevention to stop patients from actually getting to the point where they need medications in the first place, which is also really useful. But definitely a challenging situation to be in, and one that no one wants to be dealing with, because at the end of the day, you're not able to treat a patient or they don't have the money to pay for medications, which is really challenging. And we are very fortunate to have the NHS and access to a lot of healthcare and medications in this country if you live here.